This is In Black America.
I got tired of seeing my colleagues making mistakes. And long story short, while I was in residency training at Harlem, we had a patient who was high risk. We watched her very carefully, and she was preterm, but we decided, based on what was going on with her clinically, that she needed to be delivered. And it was her first baby, and she was 39 years old. So we have something in residency called a sign-out, where, the on-call team learns what's going on with the patient. We gave them all of the patient's information. I went home. I came back the next morning to be informed that she had a dead baby, and I was furious. I was absolutely furious, and I made a promise to myself that would never, ever, ever happen to me again. So as I moved along in my career, I kept seeing people who kept messing up, who kept missing the red flags of high-risk pregnancy. And so I decided I wanted to empower women to be able to learn how to recognize their own possible issues so that they could have a healthy baby.
Dr. Linda Burke, board-certified OBGYN and author of The Smart Mother's Guide to a Better Pregnancy, How to Minimize Risk, Avoid Complications, and Have a Healthy Baby. Burke is on a mission to keep pregnant women and their babies out of harm's way. She's passionate about preventing maternal deaths and the health of pregnant women. In her book, Smart Mother's Guide to a Better Pregnancy, she provides tips on how to investigate healthcare providers, what to insist on for high-risk pregnancies, how to recognize and avoid labor room problems, why keep-safe ultrasounds are dangerous, how to cope with insurance companies that refuse procedures ordered by providers, and how to make a hospital accountable during admission. I'm John L. Hanson Jr., and welcome to another edition of In Black America. On this week's program, The Smart Mother's Guide to a Better Pregnancy with Dr. Linda Burke. In Black America.
It's huge. It's huge. The journey starts with selecting the right person, because that person you have to have confidence in that person, and that person has to respect you and respect your wishes, and you have to be a team. So it definitely starts at the beginning in terms of who you go to. And that's one of the things that I've been advocating. There's a group online, Facebook group called Mocha Med, about 3,000 African-American female physicians, 500 of them are OBs, and I respect these women immensely.
Since 1990, the rate of maternal mortality in this country is higher than any other wealthy countries. The depressing increase is largely due to the alarming high rate among African-American women, who nationally are 3 times as likely to die in pregnancy or childbirth as white women. In New York City, where Dr. Linda Burke did a residency, the numbers are even more shocking. African-American women there are 12 times as likely to die from childbirth-related causes as white women. They experience severe life-threatening complications from pregnancy and childbirth in about 387 out of every 10,000 births, according to city data. That is triple the rate of white New Yorkers and roughly comparable to the complication rates in Sierra Leone. Latino and Asian women also experience higher rate of severe and potentially life-threatening complications. But some researchers and city officials believe that the higher rate of death and complications among African-American women are caused partly by long-standing disparities in poverty, obesity, and lack of access to top-rate health care. The dangers African-American women face in pregnancy and childbirth, they say, are compounded by racism, unconscious bias in health care, and the long-term anxieties, regardless of economic status, that come from being an African-American woman. In her book, The Smart Mother's Guide to a Better Pregnancy, Dr. Linda Burke provided advice on how to navigate this important period in a woman's life. Recently, In Black America spoke with Dr. Linda Burke.
I'm a Brooklyn girl, born in Brooklyn, New York, raised in a little town called Amityville and Brooklyn. Actually lived in the same housing project as Jay-Z, but we moved out before his family moved in.
Any brothers and sisters?
One brother, older.
And what were some of your favorite subjects while you were in school?
Social studies and biology.
And what made you want to study medicine?
That was a calling. I started off as a social worker, went to Columbia, great school, prepared me for a career that didn't exist. Out of my mouth one day, I just said, if I could do this all over again, I'd be a physician. I ended up seeing a delivery one hot summer night at Harlem Hospital, and that was it. I knew that's what I had to do once I saw a baby being born.
Give us an idea. What was it like matriculating through medical school?
Hard. It was challenging, but I went to a school that was very supportive, Boston University School of Medicine. Very supportive. Once they let you in, they were very committed to making sure that you got out through the front door and not the back door.
I understand. Any other people of color in your class?
Yeah. We had, I would say, good representation. Yeah, BU is the school that gave Dr. King his PhD.
Right.
And the medical school, I didn't realize it at the time, but the medical school really started out as a school that was started by abolitionists.
Mm-hmm.
There's a connection between BU and John Brown and that whole crew. So the school, historically, has always been supportive of African Americans.
I understand. Where did you do your residency?
Harlem Hospital, New York City.
And what was it like working in a big urban environment?
Well, while I was training at Harlem, I cussed a lot. It was intense, but there was once you step out of residency, having trained at Harlem Hospital, you are so well prepared. You are very, very confident. So I bless Harlem every day that I wake up because they train me well in terms of being a very, I think, good clinician and obstetrician gynecologist.
And what made you want to become a baby doctor?
So part of it was the delivery that I saw, and then I didn't realize historically I had two ancestors, both born in slavery, one in 1820 and one in 1850, who were midwives on a plantation called the Jones Plantation in Dinwiddie, Virginia. So it was in the genes, and it just showed up.
And how did you happen to matriculate to Florida?
Oh, that's a long story made short. Had a relative who sold real estate here, came down here, was not the best decision in hindsight. But that's how I got here, and somehow the Lord has kept me here.
I guess the next obvious question, why do you stay?
Well, now good question. Now I have two sons, 17 and 18, in their junior year. Florida has, the state system is, in terms of college, is fairly inexpensive compared to other schools. So if they don't get scholarships, they're runners. If they don't get scholarships, then I'm pretty secure that they'll be okay. I can pay for it if they stay here.
I understand. What led you to write this book, The Smart Mother's Guide to a Better Pregnancy?
I got tired of seeing my colleagues making mistakes. And long story short, while I was in residency training at Harlem, we had a patient who was high risk. We watched her very carefully, and she was preterm, but we decided, based on what was going on with her clinically, that she needed to be delivered. And it was her first baby, and she was 39 years old. So we have something in residency called a sign-out, where, the on-call team learns what's going on with the patient. We gave them all of the patient's information. I went home. I came back the next morning to be informed that she had a dead baby, and I was furious. I was absolutely furious, and I made a promise to myself that would never, ever, ever happen to me again. So as I moved along in my career, I kept seeing people who kept messing up, who kept missing the red flags of high-risk pregnancy. And so I decided I wanted to empower women to be able to learn how to recognize their own possible issues so that they could have a healthy baby and not be harmed during their pregnancy. Later on, like 10 years later, now it's called early warning systems. At the time that I wrote the book, it fell under no specific category because everybody was writing a book about how it felt to be pregnant. My focus was how to recognize potential problems that could spin out of control.
When you speak of high-risk pregnancies, what are you speaking of?
Women who have, and I want to say this, women of color, especially African-American women, we are all at risk. We are all high risk, and that's one of the big things that Harlem taught us. High-risk pregnancy means you have high blood pressure, you have chronic illnesses like diabetes. Sometimes these illnesses don't present until you become pregnant. If you're 35 years old and older, that's a high-risk condition. Of course, if you've got the very obvious conditions like lupus or some autoimmune disease or something of that nature, then yeah, you will know that you're high risk. But sometimes it's the pregnancy that brings forth the high-risk conditions, because when you're pregnant, your immune system is lowered, and so therefore the body, has to fight harder for infections, and this is one of the reasons why these high-risk conditions emerge when a woman becomes pregnant.
In researching for this interview, I had read an article where they were talking about women in New York City.
Mm-hmm.
And it stated that some researchers and city officials believe that the high rate of death and complications among African-American women are caused partly by long-standing disparities in poverty, obesity, and lack of access to top-rate health care. Do you concur?
I do. But the caveat to that is we have to push the needle further, because if you get stuck in the space of it's racism, then nobody's going to believe you. And so what I advocate is that people take the Sarena Approach. Serena Williams, definitely diagnosed her own condition. And that's basically how you have to roll in terms of, our present healthcare system, because it's a business. It's a business model applied to a helping profession, and the two are incongruent. They don't match, and that's why you're having a lot of issues. And I also want to say that it's not just patients who face biases and disparities. We as physicians, physicians of color, we face the same thing every day. I'll be at a dinner, a professional dinner, and one of my colleagues will be having a glass of wine, and she'll be very friendly and cordial. And the next morning in the hallway, in the hotel room, as we get ready, the hotel hallway, as we get ready to go downstairs to our meetings, she'll act like she doesn't know me. So it's not just the patients that deal with the disparities.
Let's talk about some of the things that you do speak about in the book, selecting the right health care provider. I would not think that was a major sticking point, but obviously you do.
It's huge. The journey starts with selecting the right person, because that person you have to have confidence in that person, and that person has to respect you and respect your wishes, and you have to be a team. So it definitely starts at the beginning in terms of who you go to. And that's one of the things that I've been advocating. There's a group online, Facebook group called Mocha Med, about 3,000 African-American female physicians. 500 of them are OBs, and I respect these women immensely.
How do you go about finding out what you need to know? What questions should one ask? I guess that's the question.
Okay. The first thing I would recommend is that you go online to your Board of Medicine, your State Board of Medicine website, to see whether your prospective physician has had any significant malpractice cases. That's the first step. The second step would be to see where they went to school. Not that that's really important, but sometimes it can be. And then word of mouth, talk to your friends, talk to your colleagues. I used to recommend speaking to nurses because the nurses, especially labor and delivery nurses who are dear and near to my heart, they know the 411 in terms of, what doctors show up, what doctors do the right thing. Now they have OB hospitalists, and some of them are very, very good. So that's the other thing. If your hospital has an OB hospitalist program, that's probably a good thing, because that means that all of the attention is focused on you. It's not like your doctor has to run from his office or her office to go to the hospital to deliver you.
What about routine prenatal care and potential problems?
Prenatal care is very important. It's the sooner you start seeing someone in terms of providing health care to you, the better it is. Of course, there's something called social determinants, which are social problems, and that can get in the way, like women who don't have access because of transportation issues, things of that nature. So you also want to go to either a physician or a community health center, or somewhere where people are sensitized, especially as, an African-American woman, sensitized to those potential issues so that they can customize your care. One person may have transportation, someone else may not. So that person who doesn't have transportation, the schedule of visits might be different. that person might be in a better fit in terms of seeing a midwife or someone, like they do group prenatal care. So, there are different models, and it's good to find out where you fit into in terms of our healthcare system.
I understand. If you're just joining us, I'm John L. Hanson Jr., and you're listening to In Black America from KUT Radio. We're speaking with Dr. Linda Burke, author of The Smart Mother's Guide to a Better Pregnancy, How to Minimize Risk, Avoid Complications, and Have a Healthy Baby. Dr. Burke, when one does not have a regular physician, where can they go to seek this type of assistance during a pregnancy?
So the first place you should go to would be your county health department in terms of trying to get connected to Medicaid for the first 6 weeks of pregnancy. Now, with the Affordable Care Act, things might have changed. I'm not really sure, and it's a whole other topic. We're trying to hold on to the benefits that help pregnant women. But the first place you should try to go to is like a community. If you have limited resources, a community health center. Start off with your county health department in terms of trying to get them to assist you in terms of getting some sort of insurance, like Medicaid or the Affordable Care Act, which is also known as Obamacare.
Does this allow you to maintain the same physician throughout your pregnancy and beyond, if one does that?
So it depends on where you go, because every healthcare system is different. And regretfully, a lot of the decisions in terms of where you go depends on the type of insurance that you have. So that's another thing that you have to be aware of, as opposed to back in the day where you had more choices. Depending on the type of insurance you get will depend on where you can go and where you have access. So again, word of mouth is very, very important. Some plans are better than others.
I guess I kind of skipped a couple of questions, but is it important to plan pregnancies as we know it today?
It is very, very important, but I chuckle because 50% of pregnancies are, quote, unplanned.
That's why I asked the question.
Yeah.
But when one go about the planning of a pregnancy, if we haven't touched on it yet, what are some of the other details that needs to go into that thought process?
Okay. So you have to be aware of your present health condition.
Okay.
If you're 35 or older, if you can, it would be important to have what's called a preconception visit, particularly with a maternal fetal medicine specialist, which are high-risk OB docs, especially if you're 35 or older, because they have a whole protocol of questions that they ask, and sometimes you may even have to take a test, like a cardiac stress test, just to make sure that your body can handle a pregnancy.
When one looks at their eating habits, how important is that towards a healthy pregnancy? Huge.
As you mentioned, obesity is a huge problem in terms of African American women, other women as well, Native American women, Latino women. Obesity in this country generically is problematic. So the sooner you can get some professional help if you need it in terms of guidance as to what to eat, it will definitely help your pregnancy.
Tell us about the 36 weeks and beyond.
Okay, so that's like countdown right before you're getting ready to have your baby. You need to go through a mental or a physical checklist. You need to make sure that all of the labs that are required are done. Those labs would be your STD test, chlamydia, gonorrhea, your Group B strep test. Group B strep is an infection that could cause potential problems for the baby, especially newborns. So you want to make sure that those tests are done. You want to make sure that every pregnant woman gets a screening for diabetes at 28 weeks. You want to make sure that that screening has come back, that it's normal, and that those results are submitted to the hospital where you're going to deliver. There's something called an EHR system, electronic health records, which is supposed to make it easier for your records to get to L&D by the time you go into labor, because think of it as your prenatal records like your story.
Mm-hmm.
If you show up and no one knows your story, they're missing a lot of very helpful information. So your job as a pregnant mom at 36 weeks is to make sure that your story is complete and delivered to labor and delivery.
How important is it for, I guess, the family or the mother-to-be to really have a serious conversation with the physician?
Very important, especially in terms of any concerns. And this is one of the things that I want to drive home in terms of women regarding women's health, and especially in terms of OB. Sometimes we get these feelings, these little voices that talk to us, and we ignore them. And my recommendation would be don't ignore those little voices, because those little voices could save your life. Case in point, real quick, I had a patient. I always tell patients, ask patients, is the baby moving? So I had a patient. We went through her. She was like 35 weeks maybe. Went through her exam. I heard the baby. Everything was fine. And I asked a question, as she was getting off of my exam table. I said, so is the baby moving? And she said, no, not really. Now, some people might have, said, oh, well, we heard the baby move. We're good. You're okay. I'll see you next week. But based on my training at Harlem, I said, okay, you have not felt the baby move in the same way that you normally do. And she said, no. Long story short, I sent her to labor and delivery. They put her on the fetal monitor, and they were seeing things that were suspicious. They did further testing and decided to do a C-section. And when they did the C-section, the umbilical cord was wrapped not only around the baby's neck, but was wrapped around the entire baby's body. Now, how would you know that unless you did an ultrasound, which is not traditionally done? Mm-hmm. So the fact that she didn't feel the baby move and we acted on that very small clue saved her baby's life. So those little voices that talk to you, if you feel something's not right, please speak up. Please speak up.
How important is it for you to select the appropriate hospital?
It's very important, but this is where that whole insurance dance comes in.
Okay.
So, again, start off by selecting an insurance company that gives you a lot of options. I think that's the best way to put it. You want options. You don't want restrictions.
In your years of practice, what have you noticed from your internship in New York versus what you practice in Florida?
A lot has changed. There are many more physicians that are unhappy. Mm-hmm. There are a lot more nurse practitioners, midwives, physicians' assistants practicing, some better than others. There's just, it's a very unhappy time now in terms of being a physician. I don't know of too many of my colleagues who are real. There are some, that are happy, but many are unhappy, much more than when I first left Harlem after residency training.
Do they express the cause of their unhappiness?
Oh, yeah. They feel like they are, it's like as physicians, we've lost our autonomy, mm-hmm. and some of us feel like we're being replaced by cheap labor. That may not necessarily be the best options. I mean, certainly there's a role for nurse practitioners, there's a role for midwives, there's a role for physicians' assistants, but when your whole staff loses a contract and then they're replaced by nurse practitioners for whatever reason, that would cause some level of depression. And so these are the kinds of things that are going on behind closed doors in healthcare and medicine.
In your opinion, how has insurance companies affected what you all do?
They basically, they run the show now. Now, they have medical directors, who they're called utilization review specialists. And basically, long story short, we have gatekeepers now. Mm-hmm. And not to say that that's entirely wrong, because we do have to be cognizant of the cost factor in terms of health care. But you're getting paid less and you're having to work more. And this is why I believe you have an increase in the level of maternal mortality, because people are just trying to do probably double the amount of work that was expected of them 10 or 20 years ago. So it's really like 20 years ago.
You mentioned maternal mortality. Are the rates going up considering the level of wealth that this country has?
Absolutely. Yes. Yes, it is going up. There are studies, numerous studies out there that document in terms of an industrialized country that instead of our numbers decreasing, they are increasing. And it's appalling.
So I guess the next question, what are cities and counties and states addressing this problem? What are they trying to do, if anything?
Yeah, so very good question. 2018, last year, I think late December, right after Christmas, Congress and the Senate voted for the Maternal Mortality Reduction Act of 2018. And what that does is the federal government is going to give all 50 states money to start maternal review committees. And what these committees are going to do is start looking very closely at the death rate of pregnant women in their state to see exactly why these deaths are occurring and where they are occurring. And then from that information, they are developing plans of action to help both the hospitals, actually three populations, the hospital, the physicians, and the patients, providing them with information that can hopefully reduce these numbers, because prior to the approval of the sponsorship of that bill, some states in this country were not even counting the number of pregnant women or who died of pregnancy-related issues. So this is huge. It's a huge step. More has to be done, but definitely it is a step in the right direction.
Why is it important for you to address medical malpractice situation in this country?
Complicated. It's really complicated. When you say why is it, well, I think awareness is definitely needed. You know, that whole medical malpractice liability issue it ultimately affects patients, because if the malpractice premiums are so high, this is one of the reasons why some colleagues have left OB, because they just can't keep up with the increasing rate.
I understand. If you had a magic wand, what would you try to accomplish?
So if I had a magic wand, what I would try to do is, and actually I'm working on this, I would develop an app that will teach pregnant women how to recognize their high-risk conditions.
Dr. Linda Burt, board-certified OBGYN and author of The Smart Mother's Guide to a Better Pregnancy, How to Minimize Risks, Avoid Complications, and Have a Healthy Baby. If you have questions, comments, or suggestions as to future In Black America programs, email us at inblackamerica@kut.org. Also, let us know what radio station you heard us over. Remember to like us on Facebook and to follow us on Twitter. The views and opinions expressed on this program are not necessarily those of this station or of the University of Texas at Austin. You can hear previous programs online at kut.org. Until we have the opportunity again, for technical producer David Alvarez, I'm John L. Hanson Jr. Thank you for joining us today. Please join us again next week.